Because today we got news that no one wants to hear. Oregon is once again bracing for a COVID surge, and it could be the worst one yet. This is a look at the forecast model for Omicron that OHSU released today, and this shows projected hospitalizations in Oregon from Omicron alone. This is just that variant. You can see that huge spike in January and February. And this model predicts more than 3,000 hospitalizations from the new variant at its peak. 3,000. That's more than twice as high as the number of people in the hospital with the Delta variant when that peaked in September. Now, this forecast says more boosters and other measures could bring these numbers down. But either way, researchers are not optimistic. And we realize this is really tough to hear, especially heading into the holidays. The timing is horrible. So here is what OHSU's chief medical officer said during a press conference with the governor today.
I'm sure that everyone hearing this news feels devastated and slightly overwhelmed to learn that we're facing another surge of people ill with COVID-19. Once again, many Oregonians will need a staffed hospital bed, which frankly remain in drastically short supply even now around the state. To be candid, this feels like another gut punch, particularly for healthcare workers who've been stretched truly beyond their limits. These extremely dedicated professionals are not easily phased, but after nearly 2 years on the front lines of this war, they're justifiably worn out and may well feel defeated in the face of another wave of patients sick with COVID-19.
They're justifiably worn out. That was how she put it. So during that press conference, officials also talked, because of that, about bringing in more travel nurses to help with the expected Omicron surge. It just so happens we've been exploring why that's a necessary step to keep hospitals open. And as Ashley Korsland found out, the large pay difference between those traveling nurses and local staff nurses is causing a lot of frustration because the travel workers are making upwards of 4 times the amount of money.
If you're a healthcare worker looking for a job, you've likely seen ads online like these. Travel nursing positions offering $5,000, $6,000, sometimes $7,000 a week.
The healthcare system is broken.
And you'll see videos all over social media.
Our COVID numbers are rising, and I've already complained about how overwhelmed this is getting.
It is so not normal to hate your job like that, to cry before your shift.
Nurses talking about quitting their staff hospital jobs for lucrative travel gigs. These travel nurses fill gaps in staffing at hospitals for specific periods of time, sometimes for just a few weeks.
And it's a game changer. It's a huge world of difference. I mean, the amount of respect you get, insane.
But this growing trend has created a tricky dynamic between the traveling workers and permanent staff nurses in hospitals.
It is such a large problem on many levels. We're becoming way too dependent upon travelers, and it's not a functional system for how you staff a hospital.
Matt Calzia with the Oregon Nurses Association says travel nurses play an important role, but they can make 3 to 4 times what a staff nurse makes.
Are you hearing from staff nurses about this, and what are their feelings on that wage discrepancy between what they make and the travel nurses make?
So our members with ONA there's a lot of frustration around. Our members are not feeling valued by their employers.
The problem is complicated. The pandemic exacerbated an already critical nurse shortage nationwide, with nurse burnout reaching record levels. A recent poll from OHSU showed 60% of its nurses are considering leaving the profession. And because of the shortage, hospitals are in a tough spot for staffing. That's where travel nurses come into play. Hospitals can hire directly through agencies. The state also has several contracts with staffing companies. According to the Oregon Health Authority, as of early November, the state had almost 1,000 contract healthcare workers in hospitals and other clinics. In late November, Oregon extended the expiring contract for Jogan Health through January of 2022. We looked into the contracts for 3 of the companies providing emergency staffing in Oregon, including Jogan. They bill the state based on an hourly rate. The rates in Jogan's contract, for example, include travel, lodging, and per diem. On the high end, an ICU nurse can cost up to $237 an hour. A registered nurse, $204 an hour. For comparison, according to the Oregon Nurses Association, the average salary for an RN in Oregon is around $80,000 a year. That's a pay rate of just over $40 an hour.
The travel nurse phenomenon is a Band-Aid at the end of the day.
Dr. Iman Abuzaid is the CEO of Incredible Health, a career marketplace for healthcare workers. She helps match and place staff nurses in hospitals nationwide. According to Incredible Health, 80% of hospitals have reported an increase in permanent nurse turnover during the pandemic. That's not just because of burnout, though, but early retirements, career advancement opportunities, and the fallout from vaccine mandates.
What we're seeing is that 20% of nurses across the country have chosen not to get the vaccine. What that has created is even more turmoil in the market when it comes to making nurse hiring and nurse retention happen.
We don't really know how many nurses in Oregon were fired over the mandate. There's no statewide agency that kept track. Neither did the Hospital Association nor the Nurses Association. Abuzaid says the cost associated with travel workers isn't sustainable. Most hospitals, she says, can only afford about 5% of their workforce to be temporary. Many are topping 20% right now.
It's a cost issue. Hospitals run on low margins. And when you are spending 3 to 4 times on your temporary labor, that is going to eat into what is already your low margins.
Make the work environment better. And
the Oregon Nurses Association is now calling on hospitals to stop relying on travel nurses out of fear that more staff nurses will continue quitting to take these higher paying positions.
when we look at the impacts of the healthcare system, it's just profound.
Okay, KGW's Ashley Korslund joining me now. And so such a complex problem and a lot of different vantage points to look at. You did talk, as we saw, to the Oregon Nurses Association, that's the union. And I'm wondering if they presented any sort of possible solutions or things that they would like to happen to address this.
Yeah, you know, they actually did. And so the spokesperson I talked to said it's not just about pay. That is part of the equation, right? That they'd like to see higher wages for nurses. But part of it, they would like to see more retention programs to keep the nurses they have. So that could look like having better access to mental health resources. Another thing is that they want more career advancement opportunities and trainings for people to move up in their respective fields. One other thing, they are asking the state of Oregon and the governor to kind of establish a team that could go and examine the state's healthcare staffing shortage, really take a complex look at it and come up with solutions.
Gotcha. And speaking of, you and I were talking before, and we heard from her today. You did reach out to Governor Kate Brown's office about this. What did they say?
Well, we haven't heard back yet.
Okay.
So when we do, we will, of course, pass that along to you. You know, this is a really complicated topic. It's not going away, this problem, anytime soon. And so we will be continuing to follow this story, and we'll bring you updates here as people do work for solutions on it.
All right. Ashley, great story. Thank you so much.
Thanks.